During disaster, we rely heavily on our private nonprofits for a multitude of things. Once we determine that they could be a potential eligible applicant, we look at it as whether they're going to be a critical facility or a non-critical facility. We break that down. If it's a critical facility, such as a school or a hospital, something of that nature, then they're eligible for category A through G. In our case, we have a snow disaster as well, so they're also eligible for 48 hours of consecutive snow removal. If it's a non-critical public or PNP, then they'll be eligible for the category A and the category B. If they have any kind of facility or infrastructure damage, then that'll fall under the realms of the SBA.
Well, we represent all of the hospitals in the District of Columbia on their advocacy work and their emergency response work. And I served, my organization served as a facilitator for all of the hospitals and an intermediary between all of the hospitals and the local District of Columbia government and FEMA to help the hospitals process their claims in order to get reimbursed for the funding that the federal law allows. The first thing I wanted to do was to make sure that our hospital's staff could get to work and that the suppliers could get to the hospitals with whatever deliveries they had to make sure that our patients were not going to be compromised by the disaster. So I worked with the District of Columbia government to make sure that all of the access routes were clear so that our people and the delivery trucks could get to the hospitals.
Private nonprofits, there's a lot out there, but one of the most prominent that maybe some people don't realize is your rural electric co-ops, which provide the power and that type of thing. And during a snow or ice storm or hurricane, they are affected greatly. And also too is they are a driving force to help the Commonwealth get a disaster because they play a big important part of that.
It's things that we just couldn't do and services that just couldn't be provided if we didn't have support of the nonprofit community. So we always work in close partnership, either through the VOAD, the Citizen Corps Council, or whatever means we have of reaching out to our nonprofit partners. We always make it a point to do so.